So good evening. My name is Heidi White. I am the Group Fitness and Wellness Manager at JCC Greater Boston. Special thanks to Beth Israel Deaconess Hospital Needham and Beth Israel Deaconess Medical Center for their partnership and for helping to coordinate the Wellness Speaker Series, including tonight's topic on men's health and aging with Dr. Jeremy Wyman. Dr. Wyman is the Program Director of the Harvard Medical School Multi-Campus Geriatric Medicine Fellowship Program at Beth Israel Deaconess Medical Center and sponsored by other Harvard Medical School affiliated institutions. Dr. Wyman is also a geriatrician and palliative medicine physician at Beth Israel and an instructor at Harvard Medical. He trained in internal medicine at Dartmouth Hitchcock Medical Center and completed fellowship training in geriatrics and palliative medicine at Mount Sinai Hospital in New York City. He is passionate about his work in medical education, mentoring, and helping support the careers of his fellows. His clinical focus is in the care of aging adults in experiencing illness that impacts the quality of their lives. Before I turn the screen over to Dr. Wyman, a few things to note about tonight's event. Dr. Wyman will speak for about 30 to 35 minutes, and you are welcome to ask questions either during the presentation or after by using the chat feature, so you can type your question in the chat, or you can raise your hand and we can call on you. We ask that you stay muted during the presentation unless you are asking a question, and we would love for you to keep your video camera on so it feels like that we are sitting in one big presentation room together. And so without further ado, I'm going to spotlight Dr. Wyman and turn the mic and screen over to him.
Thank you, everyone, and thanks for showing up virtually. It's been about 2 years almost now since we've been doing a lot of these virtual presentations, and it still feels weird. But I appreciate everybody being here. And just to sort of stylistically, I'm pretty informal, so please do not hesitate to shout at me, interrupt, ask questions. Can have nothing to do with what I'm talking about, and I will be happy to sort of engage and address anything that comes up. You will notice that I've purposely picked a small number of topics to hit on that I find are very popular among our patients and the general public. But if there are things that I don't cover, and there absolutely will be, please do not hesitate to ask about them. So I'm going to share my screen. Everybody can hear me okay? Okay. And Heidi, you can see this okay?
Yes.
The photograph?
Yep, I can see it.
Let me just. Still okay?
Perfect.
All right. So this picture is a picture of me and my father on the day that I was getting married. And you might first glance at this photograph and see that it looks fairly routine, right? It's a guy helping somebody else put on their tie. If you look closely at the photograph, you'll notice, if you look at my father's left hand, you'll see that it doesn't look quite normal, right? It looks sort of thin. You can see the veins. Maybe if I hadn't even pointed it out to you, you would have said, doesn't look striking. It's also a little weird because I'm tying his tie, right? He's supposed to be tying my tie. I'm the one getting married. The reason for this is my dad, who is now 73 or 74, and has also been a physician for over 40 years, got something called Guillain-Barré syndrome when he was 65 years old. He was healthy as could be, got a gastrointestinal illness, diarrhea, felt better about a week later, and then Guillain-Barré is an autoimmune reaction that attacks the nervous system. And within 2 days, he couldn't walk, he couldn't move his arms, couldn't move his legs, and he was in Spalding Rehab Hospital for 4 months before he could stand up again. Now, I'm not telling you to depress you. He's recovered a lot. He does not have the same strength that he once had. But I'm telling you this because, a lot of times we deal with people's questions about what's normal, what's abnormal. Is I'm experiencing this and I'm aging. Is that how it's supposed to be? Or is there something wrong here? And I think a lot of times people blame, aging for the cause of what they're feeling or what's going on. And sometimes that's true. And sometimes it isn't. So one of the things I'm going to try to do on a couple topics tonight is talk a little bit about, what's normal, what's not. So I'm going to start with a couple of true or false questions. So true or false, the ability to recognize familiar faces or objects naturally declines in all people after age 65 to 70 in most healthy adults. True or false? Give you a couple seconds to think about it.
You can unmute to answer.
Most people are
False.
False.
Yes, that's correct. It is false. It is not normal to lose the ability to recognize things that have been familiar, whether it's people or whether it's places or whether it's objects that you recognize after 65 or 70. That is abnormal. What about the next one? So episodic memory, working memory, and executive function, and I'll explain what these things are the part of one's mind most affected by aging. True or false? You can say, I don't know, if you're not sure. So this is true. This is true. And this is one of the most common things we talk about with our patients in the office. So somebody comes in and they say, so one of my patients who's 78, who's been running his own financial consulting firm, says, I am still working, I'm still successful, I have a lot of clients, but I'm just finding that it just seems like it's taking me longer to do the same tasks than I did 25 years ago. And also, when I have a new client, I find that maybe I have a more difficult time remembering that person's name than I would have 20 years ago. That's normal. Doesn't mean you have dementia. Doesn't mean you're going to get dementia. It just means that the brain is having more difficulty performing that function than you might have 20 years ago. Last one. So most adults with Alzheimer's disease or dementia live in a nursing home a few years after diagnosis. True or false?
False.
False.
Very good. So this is very false. The majority of patients who have Alzheimer's disease or dementia live in the community. They are living in their homes, their apartments, their condominiums. The vast majority live in the community and are not in nursing homes. So very well done. So normal and abnormal aging when it comes to the brain. Any primary care doctor that you go and see, if you go in and you tell them the following things are happening with my brain, is this because I'm 65 or 55 or 80, or is this because something's going on that I should worry about? You should be able to get a clear answer to that question. There are very specific things that a doctor should be able to tell you. Yes, that is totally normal. Once every 6 months, you leave your keys somewhere in your house and you can't remember where you put them. That does not mean you have dementia. But if there's a concern that you are having things that are going on with your memory, your language, your decision-making processes that are affecting the way your day goes and your function, that is something we need to look more into. So I'm going to go through a couple sort of key things. And if you said to me, like, what are the most important things that I can do now in the future to promote brain health, whether you do have some underlying memory issues, whether your memory and your cognitive performance is as healthy as can be, these are 5 or 6 things that I think are crucial. So, not to sound like a broken record, but there's almost nothing I can say that is more important for your health as you age than exercise. I mean, literally, there's almost nothing. Specifically in terms of the brain, a really good example is, so patients who have Parkinson's disease and have a lot of challenges with motor function, movement, there's really, really excellent data to suggest that if you put these patients in a boxing program where they are, punching pads, working their muscles, this creates significant strength in their function, their balance, and their walking ability. And I could go through a whole number of different, studies. But this is, when you say like, well, okay, so what's exercise? Like, what do I need to be doing? 150 minutes a week. So 5 days a week, 30 minutes a day, 3 days a week, 50 minutes a day. And what do I need to do? Literally just start with an exercise walk. If you can get into an exercise walk and you can do that 5 days a week, you are so far ahead of most people. If you can build on that and you can actually do some and add in some different types of exercise, so riding on a bike, working on an elliptical, doing some really mild weights a few times a week, that's even better. If you said to me, well, do these things help, treat dementia? No, they're not going to reverse your dementia. And if you have really, really mild memory issues that are beyond, just related to normal aging, there is some evidence that they can slow down progression and worsening memory loss. So this is so crucial. And if I could prescribe this in a medication, I would, and it would be like gold.
Can I ask you a question about the exercise?
Please.
Is there any difference between 5 days a week, 30 minutes, better or worse than 3 days a week, 50 minutes?
So it depends on, I think yes, and I'll tell you why. The question is what are you doing if you exercise 3 days a week for 50 minutes? The question is what are you doing to keep moving in the other 4 days? So if you're supplementing it with some other activities and movement and you're staying active, then no, I don't think it's a problem. But if what you're doing is you're having, 3 days where you're very active and 4 days where you're pretty inactive, your muscles are not being challenged. Your nerves are not being challenged at all. So if I could choose one, I would do, a less amount of exercise each day, but more frequently on a daily basis than, bolusing just 3 days a week and doing more on those 3 days.
Okay, thank you.
Because I think you sort of lose some ground when you're not as active those other days.
Okay, thank you.
And if you said to me, why is the exercise so important? Is it directly impacting the brain? It's both on the way it impacts the brain, but even more importantly, there's almost always associations with blood pressure, blood sugar control, weight, if you have diabetes. And so, the exercise isn't just helpful for the brain, but it's helpful at treating these other conditions, which are indirectly associated with the brain. The next piece I would say is nutrition. And this is like a, week-long talk in itself. But if you said to me, what are the key things that I can do on a daily basis to sort of promote brain health from a nutrition standpoint? So reducing the amount of high sugar foods. So things like pastries, cakes, foods that have a lot of white starch in them, all things that are really delicious. Reducing portion size and being somewhat attentive to mealtime. So, not having 3 meals a day and 4 different snacks. Other things that are key, so diets that are high in omega-3 fatty acids. So this includes things like salmon, other oily fishes like Arctic char, trout, Other things like walnuts, flax, and chia seeds are also good. So like I have oatmeal every morning, and I don't really like the taste of flax and chia seeds, but putting a teaspoon of one of those into your cereal with a little bit of fresh fruit sort of dilutes the taste and is a good way to get some of that in there. I have a lot of patients who take omega-3 fatty acids. There's some evidence to suggest that this may be helpful in promoting brain health. The studies haven't shown this, but I think that's mainly because you have to take omega-3 fatty acids for so many years, to really see a benefit. And we just haven't really had the, 20 or 30 years of data to show that. But if you said to me, what's the one vitamin I'm going to take or supplement I want to take that would help potentially with brain health, it would be omega-3 fatty acids. So the third thing I would say is social stimulation. So I think this.
Could I ask you a quick question? You mentioned salmon specifically. There are all kinds of opinions about farm-raised salmon and how it's not particularly healthy. Are you more specific on the types of salmon?
It's a very good question, and I think the jury's out, because you could certainly make the argument that in some places, if you're just, for example, getting wild salmon, question is how clean are the wild portions of the sea that we're getting these fish from anymore? So I think it's very challenging. I think what I would guide you to do is, if you're buying farm-raised salmon, depending on where you're getting your fish from, you're going to the fish market, talk to the guys at the fish market about where the farm salmon's coming from, right? Because you can get farm salmon from Scotland, you can get it from Maine, you can get it from Alaska, you can get it from Chile, and it matters because the water where you're getting, the water where they're getting it in Chile is not the same as the water where they're getting it in Scotland. So if you're getting farm-raised salmon, I think you can get a lot of good nutrients, but I think having an awareness of where it's coming from is helpful. And then I also think, I've heard a lot of people say, the wild salmon doesn't taste as good. So, I think getting some intake is the most important part. And talking with your local fish guides about where do they think the healthiest fish is, they may say, the trout is, the wild trout is healthier than the salmon we get, and going with that.
Thank you.
So social stimulation, this is another key part that we're learning is crucial to brain health. It's interesting when they study communities, some of the communities that sort of live in the closest proximity with really rich social connections seem to have a real protective effect on brain health. And why is that? I mean, I think that when you have tight communities, you've got, the ability to communicate, there's stress reduction, there's intellectual stimulation. I mean, all the things from people that are close with you in your life or in the work environments. There's some feeling that there may be a connection with oxytocin, which is stimulated in the body, and that's related to social bonding. So, what we tell patients is, it's very easy to get more isolated as people age, right? You have close friends, family members who pass away, you may retire. These communities that are central to how you've, grown over the years become harder to stay in touch with. So we really encourage people to try to stay connected and work on remaining connected to those communities in ways that, still bring joy to your life. So sleep seems to be an epidemic among a lot of our patients. Patients say, and I can't fall asleep, I can't stay asleep, I wake up in the middle of the night to pee. I need medication to help me sleep. I've been taking medication for years. There's so many different algorithms. If you said to me, what are key things that are crucial to me getting good sleep, I would say having a schedule. So doing the same thing every night is very important. I also tell people, what time do you want to wake up in the morning, and work backwards from there. So I can't tell you how many times people say to me, I want to get up at 6:30 in the morning. And I say, what time do you go to bed? And they say, well, I get into bed at 8:30. And I said, you can sleep for 11 and a half hours. They say, no, absolutely not. I say, well, you're getting into bed and you're setting up a situation that's totally unrealistic. You know, no wonder you're waking up at 1 o'clock in the morning and you're frustrated. You can't force your body to get more sleep than it needs. So I try to encourage people to figure out what time do they want to wake up in the morning and how many hours of sleep do they need at night to feel rested. And so if you say, you know, I think I need 7.5 hours of sleep at night, and I want to wake up at 6 o'clock in the morning, don't get into bed until 10:15 at night. Because otherwise you're going to create a mechanism where you're trying to force your body to do something it doesn't really want to do or can do. I certainly try to, you know, encourage people if they're getting into bed and they're ruminating, they're stressed, they're anxious, figuring out ways to try to get calmer before you get into bed, ways to distract yourself, try to encourage people to avoid caffeine later in the day. Or things that stimulate them, whether it's TV programs or even communicating with somebody, a family member, a friend that can get them worked up. Sleep is increasingly thought of as key to a time when built up waste proteins that have accrued during brain metabolism need to be cleared out. It's like the time when the brain is taking out the trash. So sleep overnight is key to, you know, having the brain sort of reset. Any questions about what I've covered?
Dr. Wyman, we just got one question in the chat, which I'm not sure if you want to save for later, but the question is at the end, can you discuss how these factors tie into COVID?
Yeah, it's a great question. Can you remind me to tackle that at the end?
Yes.
Okay. So we're going to dive right into a different part of the body, men's genital urinary tract. So true or false? The normal aging man's penis needs greater stimulation to attain an erection, get a spontaneous erection. Erections are less firm. Refractory time between erections or ejaculations become prolonged, and ejaculation is less forceful with smaller ejaculate volumes. True or false? That this is a normal part of what is expected to occur for men as they age.
True.
True.
Correct. You will see below this, I also have a part about the women's genital urinary tract and normal expected changes, which I'm not going to go into. What I'm going to say is that despite all this, which doesn't sound like fun, I mean, I'm not looking forward to this. Study after study continues to report that aging adults continue to express a desire to be sexually active. In fact, if you look at studies, they will continuously, time after time, show that people as they age, 60s, 70s, 80s, are as interested in having sex as teenagers, as people in their 20s. The major barrier, as many of you may have encountered or be aware of for friends, is partners. That is often the biggest challenge. So, you know, a lot of adults who are over 50 report at least one bothersome sexual problem. So for women, this could be difficulty with lubrication, difficulty climaxing, low desire. Men, the most common, study after study after study, is difficulty with erections. It's really interesting. If you look at the data of men over 50, 60% of them report that they have never had a conversation with their doctor about sex after they're 50 years old. That's true of 80% of women. I can't speculate as to why exactly this is happening, other than I would say that I think doctors feel uncomfortable asking, and they're rushed. And so a really important topic doesn't get brought up unless the patient asks. And I think the patients sometimes feel uncomfortable talking about this. So, you know, what do I recommend people doing? I recommend people bringing it up like they do their knee pain or their shortness of breath or their rash. This is just as important as any of those things. And sometimes it's a tip off for us. So if you come in and you say to me, you know, for the last 50 years, I've never had problems getting an erection. And, you know, over the last 3 weeks, I'm all of a sudden having difficulty. that sometimes raises flags for me. Difficulty with erections can be associated with cardiovascular disease. And so these are really important conversations to have. I think it's important for you to tease out with your doctor if any of this is related to grief, anxiety, stress, or other health issues. As well, a lot of times there are medications that your doctor puts you on that can cause this as a side effect. So a really common side effect from antidepressants, for example, can be changes to sexual function. So it's really important to bring this up. And, obviously the common thing that I'm sure all of you are aware of from watching TV that treats this is things like Viagra, Cialis, and there's very mixed results. Some of these are helpful for patients and some of them tell me it didn't do a goddamn thing. There are other options. There are not as simplistic as using a pill, but there are other options to help with erectile dysfunction. So it's not a pill or not as the only option. So I need to pee in the middle of the night. Sometimes I get up in the middle of the night to pee and I say, this is just what it's going to be like. And it's just going to get more and more frequent. So question one, is it normal to have to get up in the middle of the night to pee? Yeah, it's actually not that abnormal. The question is how much is it occurring? So the classic thing, you may have heard your doctor talk about nocturia. Nocturia is a fancy way of saying, I get up at night to pee. We define it as at least doing it once a night and a feeling that this is interfering with your daily function. So you get up at night to pee, you can't fall asleep easily after that, and you wake up the next day tired. So if your next question is, does it have to be this way for the rest of your life? No, not necessarily. There are a lot of things that are associated with this condition. So high blood pressure. People whose blood pressure isn't well controlled can often find that they have to urinate at night. People who have blood sugar problems or diabetes also can find that they're having to get up and pee at night. People who drink alcohol, a lot of alcohol before bed, even a glass or two. Alcohol is actually a diuretic. So if you tell me I have a beer and a half at 6 o'clock at night, I can almost assure you that that's going to increase the amount and the frequency you have to pee in the 10 hours, after you have that drink. Unrelated, you'd think, well, what does this have to do with, having to pee? So you may have, or you may know people who have sleep apnea. Sleep apnea is often something that's highly associated with urinating at night. And so oftentimes we find if you treat the sleep apnea, people's urinating at night gets better. I mentioned alcohol. So if you said to me, like, look, I love having a gin and tonic in the evening, don't tell me I can't do that anymore. I'm not saying you can't do anymore. I would actually encourage you to do it earlier. So if you're trying to get in bed 10:30, 11 o'clock, and you're used to having a glass of wine 7:30, 8, 8:30, 9 o'clock, and you're having difficulty urinating at night, move it up a couple hours. Have that glass of wine at 5:30 or 6 o'clock, to give your body some time to urinate and get it out before it turns into a middle of the night thing. Caffeine is also a big one. So if you're having difficulty urinating at night, I'd recommend also moving that caffeine up, cut the caffeine out beyond 12, 1, 2 p.m. in the afternoon, or reduce the amount of caffeine in the coffee or tea that you're drinking. Same thing goes with soda and iced tea. Medication. So any of you who have high blood pressure, this is another good one. So make sure that the medications you're not on for high blood pressure aren't causing urinary symptoms, because some of them act as diuretics. And so if this is an issue for you, it's a good thing to bring up to your doctor and say, hey, is it possible my blood pressure medication is causing urinary issues? And is there something that would be less likely to cause urinary issues? Diabetes, anybody who has blood sugar issues. So how does sugar get out of the body? One of the ways is it gets put in the urine. Well, how do you pee out sugar? The body has to pour water to dilute the sugar into the urine. So the sugar is in the urine, drags the water out, and you have to pee. So better blood sugar control often leads to reduced urinating at night. Trickier things like in a large prostate. So when a prostate gets enlarged, it can push on the bladder, and that can often make you feel like you have to pee. Oftentimes that can be something that occurs both during the day and at night. And there are different ways to treat that, both with medications and other types of bladder therapy. And then urinary tract infections. Urinary tract infections generally cause urinary problems both during the day and at night. So that's less of a night specific thing. The other thing I would say, that for any of you who've ever gone into your doctor, seen a doctor with non-specific concerns about urinating. Let's say you say, I'm urinating frequently or too frequently, or I feel like I'm peeing and I don't get everything out. And you go in and you have a urine test from your doctor. And the doctor says, well, there's bacteria in your urine. So it is true that when you have a urinary tract infection, it's often from bacteria in the urine. One of the trickier things, though, as people age, we find that bacteria seem to live in their urine. There's some colonization that goes on. So it doesn't always mean that just because somebody finds bacteria in your urine, that it needs to be treated. There's a reflex in medicine that anytime you find something, you put people on an antibiotic. Just be sure to have a good conversation with your doctor about whether they really think that's causing you to actually have problems, or it's just there, because it doesn't always have to be treated. So people oftentimes wonder about fatigue. I'm tired. I don't have the same energy I used to. And sometimes we get this question of, do I need testosterone replacement? There's a lot of commercials, there's a lot of ads for this. This is a really complicated topic, and the bumper sticker I'll give you is it's just not that simple. And why is that? There's a couple things. So if I went and I tested every single one of you who's on tonight's testosterone levels in your blood, probably 25 to 30% of you would have testosterone levels that are lower than, quote unquote, what we say they should be. Now, that doesn't necessarily mean you need testosterone. You need testosterone supplementation if you're having something that we think is caused by the low testosterone. So what would that be? Let's say you said, look, I'm interested in sex, but I just feel like I could care less about it anymore. It's just not a priority for me. I have no interest or urge, even though in my brain I would like to. And we measure your testosterone level and it's very low. That's a real consideration to have a conversation with your doctor about. The reason why we don't just put everybody on testosterone, whether that's in a muscle injection or a patch or testosterone gel, is the science is really tricky. So they've tested it to see, does it help with strength? It does seem to actually help a little bit with strength, but it doesn't reduce your risk of having a fracture. It seems to increase some of your red blood cells. So if you have problems with anemia, it can help with that, but it's also been shown to increase plaque in the heart. And there's some association with blood clots. It has not been shown to improve memory. It has not been shown to improve physical function like walking speed or climbing stairs. And there's some association with prostate cancer. So, anytime you're thinking about something like testosterone, it's a risk-benefit conversation with your physician about, how high risk are you for having one of those side effects? And is there something going on with your body that they think is truly related to the low testosterone, or is it just a bystander? Questions about that? I'm going to talk for a few more minutes, then I'm going to let you guys chime in. So what about the gastrointestinal tract? So is it normal for aging adults to have gum recession, more tooth decay, and loss of teeth contributing to an increased risk of poor nutrition? True or false?
False.
So this one is actually true. It is normal for there to be gum recession, and there is more tooth decay. And loss of teeth definitely contributes to increased risk of poor nutrition. Why is this? One of the big things that occurs is that there's a change in it's a change in glandular function. So if you think about your body and you think about things like, why is my skin dry? Why do I find that I have to rub my eyes more? Or at night, my eyes seem dry, or my mouth seems dry. One of the cruel things about aging is the glands that secrete, liquid and fluids that keep things lubricated, a little bit like an old car, don't work as well. It's not that they don't work, they're just not as prolific as they used to. So, mouth care, gum care, tooth care is really important. There's increasing data to suggest it's part of brain health, and that increased plaque and inflammation in the mouth is associated with cognitive changes. So I definitely recommend, if you have a good dentist, stick with the person, continue to see them every 2 years. When they give you feedback about concerns, take it seriously. I have a lot of patients who tell me like they haven't seen a dentist in 10 years. So it's really important. Dry mouth, also very common. So that's another thing to keep in mind. What about constipation? So if I told you a quarter of all adults over 65 develop constipation related to changes in nerve endings in their GI tract, would you tell me, yeah, sounds about right, or that's crazy? So this is another one that's true. And constipation is an incredibly common thing. And how do I define constipation? I define constipation as really simple. I used to have a bowel movement once a day. Now it's once every 3 days, and that bothers me. And it bothers me in such a way that I have to change what I want to do. I have to change my diet. I have to change my daily routine, and that really annoys me. There are a whole bunch of things that help with constipation. Everything from increasing dietary fiber, increasing the amount of fluid intake, increasing your activity levels, and then there's a whole bunch of ways that we can help make bowel movements easier, whether it's supplements or actual medication that help with constipation. So do not suffer from this silently. This is definitely something you can talk with your physician about. Last thing I'm going to talk about is osteoporosis. So osteoporosis is not just a women's problem. You hear this probably from women more often. And why is that? Well, most women are recommended to have screening if they haven't had it earlier, at least by 65. Women's bone density drops at a younger age compared with men because of changes in their estrogen levels. So estrogen levels generally start to drop around menopause, and accordingly, their bone health is less protected. Men don't have this change, of course, with estrogen, but they too start to accumulate bone loss. And right around 65 to 70, they're losing bone at the same rate as women are. So, it is completely reasonable if you've never had a bone density test and you're going in to see your primary care physician, you're 65, 70 years old, to say, hey, what do you think about having a bone density study? What's a bone density? A bone density is a fancy X-ray that looks at your bone strength. And why does this matter? This matters because if I fall over right now and I fall on my side, it is very unlikely I'm going to fracture my hip. But if I'm 70 years old and I have osteoporosis and my bones are weak, it is quite likely that I will have a hip fracture, and hip fractures are life-changing. You will be very unlikely that you walk the same way again. So it's a threat to independence, it's a threat to your balance, and it's something that we can treat. The goal of treatment, if you have osteoporosis, is to give you medication that reduces your risk of having a fracture and keeping your bones stronger and reducing their rate of decline. So this is something that's definitely worth talking with your doctor about and getting tested for. So I'm going to pause there at 7:45. open it up for questions.
Dr. Wyman, do you want to unshare your
For those
presentation?
of you who are not,
There you
those of you who
go.
are still awake. Yes.
Is, when you were talking about exercise, what about, are you talking primarily about aerobic and strength exercise? Would you include stretching in that 150 minutes a week?
So I would add stretching as supplementary. I don't think stretching can really be included in that 150 minutes. I don't think it's really getting your heart rate up enough. So, you know, when I say walking is crucial, if you're going to do nothing else, do walking for 30 minutes a day. Why is that? You're like, it's just walking. I mean, walking it's getting your heart rate up. It's challenging your muscles and your nerves to interact with the environment. And those things might seem like they're easy, but they're absolutely essential. So, you know, I think of stretching as supplementary. It's really important, but it can't replace that, you know, other actual more rigorous exercise daily.
Thanks. And what about about sleep? What about taking things like melatonin?
Melatonin is completely fine and safe to take. You know, you're trying to supplement and mimic something that's naturally produced in your body. Melatonin, I think of as coming in the package of all those other crucial behavioral things that are so powerful, right? So what's the place that you're in when you're getting in bed at night? How many hours are you trying to sleep for? Are you setting yourself up to get in bed at the time? You know, if you're I put myself in like a 7.5 hour a night kind of guy. And I find that if I fall asleep on the couch, if I fall asleep on the couch at 8:30, and then I go and I get in bed at 10:30, I literally wake up earlier, and it's like I can't complete my night's sleep. And then it puts me in this cycle where I'm frustrated because I didn't sleep well. And then it is a ton of psychology built into sleep. So melatonin is fine. If you said to me, what dose would I start at? I'd start at 3 milligrams a night and go upwards from there. And the other thing I would say to that is, if you feel like you are getting in bed and you're like, I just feel anxious. I feel like I'm lying in bed and I'm thinking about all the things that I'm worried about and I feel stressed out. That is really important to pay attention, because melatonin is not going to fix that. A book may not fix that. And you need to think about, how do you actually bring that anxiety down so you can relax enough to go to fall asleep.
Doctor, how have you addressed the question of COVID with your patients around the key activities that you mentioned?
Can you be more specific?
Well, social interactions have been reduced a great deal. Concerned about even going out. So walking is okay as long as it's not 10 degrees, but it still seems like we've limited a lot of our social interactions aside from Zoom and telephone calls. And it seems like that can affect our mental health a lot.
100%. So here's what I'll say. If you are vaccinated and boosted, the person and people that you're interacting with are vaccinated and boosted, and they are interacting with a lot of others, I think that taking a rapid COVID test the day you're getting together is a very low cost thing to do for you. And I think that all of those things reduce your risk of transmitting and getting COVID. If you're getting together indoors, I do think it's helpful to keep a couple windows open, fresh air circulation. But I think we've gotten to a point where I think vaccinations are effective enough, and people have tools to provide a very low risk environment to gather together, such that that social interaction, I think, is more important than the very low risk of transmitting COVID together. Now, if you're immunocompromised, if you're getting together with people who are not going to test themselves and are not vaccinated, I think that's a different category of risk. And I think that makes getting together more challenging with those people indoors.
Just to also add, at the JCC, we've been offering in-person group fitness classes, which a lot of our members have really enjoyed. Everyone is masked, and we are monitoring capacity in those classes just to allow people to spread out and feel as comfortable as they can and be safe, but they really enjoy being together in person. And we're also offering the classes on Zoom as well.
Yeah, I'm so glad to hear you guys are doing that. And I think, I am definitely, there was a time during the pandemic when I think we told people it was really too unsafe. I think we're at a point where, given how long this has gone on, that the impacts of social isolation and loneliness and, it's just, I think you have to weigh what is now a fairly low risk if you are checking those boxes with what you're losing if you're continuing to sort of be completely alone and isolated.
What on the COVID front there? What's your view on how long the booster lasts? In other words, they originally said, wait about 6 months after your second shot to get a booster. In my case, we were traveling, so I got the booster as soon as it was available, which was last August. And we're traveling again in March, and I was kind of scratching my head, is another booster even in the conversation, or does once you're fully vaccinated and boosted, you're good for 9 or 12 months?
I think that's a complicated question. I think you're in pretty good shape if you're vaccinated and boosted. I think part of it depends on what if there is a next variant looks like. I will tell you that, having seen this in the hospital, I've been, rounding all week, it continues to be true that the vast, vast majority of patients who I see in the hospital who've gotten very sick from COVID at this point have not been vaccinated or have not been boosted. Of the patients, I've seen probably a dozen patients in the last few weeks in the hospital who have had COVID in the last month. The vast majority of them are in the hospital for another reason. They've recovered from COVID. They are very, very sick patients. But because Omicron has been much milder, they had much more sort of cold-like symptoms. Now, that may not continue to be true if there's another variant, but I think for right now, you're in a good position if you've been boosted. And I think we'll probably have guidance in the next couple of months about, when the next time point for a subsequent booster will be appropriate. But I wouldn't worry that you need to go into the pharmacy and sort of, tell them that it's been, a year since I had my last vaccination. I need another booster.
Thank you.
What is the evidence on the effectiveness of the advertised brain activities or memory activities to help as you age?
The brain games, those types of things. Truthfully, the evidence is that by doing them, you get good at them. So, the way they're sold is, this helps improve brain function. It does help you get better at doing the game. But none of these things are proven. Prevagen, which is sold, and has amazing advertisements and is not cheap. There's zero evidence to support its usefulness at all. So the brain games, are really not super helpful. If you said to me, what types of games would I recommend? Continuing to read, if you're readers, crossword puzzles, things that challenge your brain to learn new activities. So taking a course, the brain reacts when it's challenged with new things. So if you're going to do brain games, pick a new game every week. Don't stick with the same game over and over.
I noticed as I got older that at one point, even though I was fairly active, my balance started deteriorating. And I found, learning how to walk better, better way to walk exercising, walking a lot, you know, like 2.5 to 5.5 miles a day, like for 5, 6 days a week, weather permitting, and learning different approaches to improving balance has helped dramatically. But it was like a real surprise to me that all of a sudden I found that my balance was off.
Yeah, I mean, thank you for sharing that. And that gives me the opportunity to put a plug in for physical therapists. Physical therapy and the benefit from Medicare and insurance is such a great benefit. I honestly feel that if all of us had a physical therapist who would work with us once or twice a week, we would all be healthier, because there's so much good they can do from, muscle work, balance work, strengthening work, even for those of us who, we're like, I don't need a physical therapist. They're just very, very good at health and strengthening.
Dr. Wyman, there's a question in the chat about hearing loss. Is whistling in the ears an indication of anything serious?
It's not necessarily an indication of anything serious. So it can sometimes hard to differentiate whistling from what we call tinnitus, which can sort of be a ringing. But if you're having new changes in your hearing, whether it's whistling, other sounds, muffledness, I would recommend 2 things. So step 1, having somebody look in your ears and make sure they're not impacted with wax. If they are, definitely have them cleaned out, either by your primary care doctor's office or the ENT. ENT has these great little sort of like vacuum devices where they can literally clean them out super quickly if the PCP can't. If that doesn't fix the issue, you should definitely have a hearing evaluation from an audiologist to see what's going on.
Other questions?
I have a question about neuropathy as a result of spinal arthritis. Are there any things, I've been told vitamin B6 might help. Other people tout the benefits of CBDs and other marijuana derivatives, but it really affects, especially in cold weather, my ability to walk and my balance.
Yeah, this is a great question, and it's a very tricky one. So I would say the following, which is there are probably somewhere in the range of 12 to 15 different medications that you can try to attack neuropathy, pain related to neuropathy. Sometimes people find that they find one that's helpful when they've tried a whole bunch of the others and they do nothing. I would say that avoiding triggers, things that trigger your neuropathy, is very difficult but important. So I've had patients who tell me, I made the mistake of going outside barefoot in the winter and it completely triggered my neuropathy and I haven't been able to get it to settle down in 3 months. So, I mean, if you know that there are things that trigger it, like changes in temperature, trying as much as you can to try to keep your feet warm. Physical therapy can be effective, acupuncture, massage, these are all things I would try. Oftentimes it's very individual. A lot of things work for one person and they do nothing for somebody else.
I had a question about vision. Actually, I'm beginning to see occasionally a little light flickering in the dark in the corner of my eye. I'm just wondering, is that an aging kind of thing, or is there something else going on?
No, I wouldn't say that that's normal. When was the last time you had an ophthalmology evaluation?
About a year ago, I think.
Yeah, I would definitely go back and I would follow up on that, because it's not something that I would say, oh, that's just because you're 74 years old. Don't worry about it. I definitely think that's worth following up on.
Okay, thank you.
Just a nice comment in the chat. It's a pleasure being at a meeting with almost all men. Most meetings I go to are mostly women.
I had a comment. First of all, great presentation again. I am a dentist, and I threw a note in the chat. I agree with you that the loss of teeth contributes to poor nutrition. But I feel that older people are more at risk for gum recession and decay, but it's not normal, in my opinion.
I would love to have you in our clinic anytime you're willing. You would have no shortage of business.
That's why I'm retired. So I can go to the JCC every day.
A lot of it's dietary, also previously a dentist. A lot of it is dietary. It's refined carbohydrates and sugar and historically over the person's lifetime, it builds up and really have more problems because of that. So you can say it's normal because it's not unusual, but it doesn't have to happen.
These are very good points. I appreciate your adding these. Thank you for your expertise. It's also great to have such accomplished people, meeting together.
A lot of us older folk are pretty accomplished.
I know. That's why it's so much fun. That's so much fun working with you guys.
So I think it's what I've seen in terms of a lot of the different meetings I've gone through. There's some really incredible people with incredible backgrounds, and of course, 50 years ago, I wouldn't have looked at people like that with the same sense I have now. They're old people, but there's really a history of successes and really brilliance about different things. We each have wonderful treasures and great wisdom and great stories in us, and it's a great thing to be able to find it.
You caused me to think something. Are regular massages helpful? Full body massages?
Oh my God. I mean, if I could have insurers cover that, I know I'm sort of making a joke, but like I think there is so much unproven, but I hope eventually science will bear out. I have had so much success with some of my patients who have osteoarthritic pain, whether it's complicated knee issues, back issues, hip issues, neck issues, shoulder issues. I mean, good massage can be so powerful from a treatment perspective. It's also obviously can be really helpful for stress and anxiety, but yes, I am a big fan of recommending that. And interestingly, some physical therapy practices actually have, massage therapists who are more focused on, injury and pain rather than just sort of your typical massage parlor that, may just be more focusing on relaxation. So resounding yes.
Thank you.
Do you recommend meditation?
Absolutely. I think meditation is incredibly powerful for anxiety, for stress, for mindfulness. I'm a huge supporter of meditation.
Just to mention, we are offering a lot of these things that we're talking about. We have a balance and injury prevention class. We offer meditation, both in person and online. I just put my email address in the chat. If anybody's interested in reaching out to me, I would be happy to share what we're doing at the JCC to see if that's something that you would be interested in.
I just wanted to chime in. I'm Audrey Edwards. Some of you guys I recognize. I apologize. I joined a little late. I have the privilege of working with Heidi. I'm the Health, Fitness, and Wellness Director at the JCC, and I'm so moved and I feel so privileged to have sat through this presentation. Dr. Wyman, you were amazing. And Marvin, I agree with you. What a great group of people, interesting, accomplished, such great engaging questions. Thank you, Heidi and Dr. Wyman, because I think this really, this was a great job. Trying to find the words. I encourage you all to reach out to Heidi. I'm glad you put your email in the chat, Heidi. Heidi really works hard at keeping her finger on the pulse of our community. And you'll see if you log on to our website, the diversity of what she offers from a wellness lens is incredible. But if there are things that we're not doing that you would like for us to do, please reach out and let us know, because our answer is always yes. We have the honor and the luck of working with these great hospitals, people like Dr. Wyman, and we love bringing this to the community. So thank you all. This was incredible.
Also a Parkinson's wellness program too.
Yeah.
Any other questions?
Is the Parkinson's and Wellness Program, is that affiliated with Caroline Colas too?
No, it's affiliated with Beth Israel, actually, Beth Israel Deaconess Medical Center. And we're also offering rock steady boxing classes too.
Yeah.
All right. I think we are good. Oh,
I just
sorry.
want to, I just want to say that, you know, it's my pleasure and honor to come and, you know, connect with you guys. And I really appreciate your, you know, showing up, and you're asking great questions, and, you know, would be delighted to learn more from you about how we can, you know, as geriatricians and doctors, be helpful to information sharing, learning together, and be happy to communicate in any way going forward as well. So thank you all for being here.
Thank you so much. And just a few closing words. In addition to thanking Dr. Wyman, I just want to thank Beth Israel Deaconess Hospital Needham and Beth Israel Deaconess Medical Center for sharing this important information about men's health and aging. And if you would like to hear this presentation again, or if you know someone who might benefit, we will be posting the recording or uploading the recording to the JCC Greater Boston website on the Wellness Speaker Series page, or you can also access the recording using our online video platform, JCCGB+. And our next speaker event will be held on Wednesday, February 9th on achieving a good night's sleep with senior nurse practitioner Rena Holzer. And to learn more about that event, you can also email me directly. You can also just search on our website, the Wellness Speaker Series. And thank you so much for joining us. Thank you, Dr. Wyman.
Thanks all. Stay warm.
That was definitely.
Thank you.